Chronic myeloid leukemia (CML), also known as chronic myelogenous leukemia, is a type of cancer that originates in the bone marrow, where blood cells are produced. CML primarily affects the myeloid cells, which are a type of white blood cell responsible for fighting infections. It is characterized by the overproduction of abnormal, immature white blood cells, which accumulate in the blood and bone marrow, crowding out healthy cells. The exact cause of CML is not entirely understood, but it is closely associated with a genetic mutation known as the Philadelphia chromosome. Philadelphia chromosome. In about 95% of CML cases, the disease is caused by a genetic abnormality known as the Philadelphia chromosome. This chromosome forms when parts of chromosomes 9 and 22 swap places a translocation, creating an abnormal gene called BCR-ABL. This gene produces a protein that leads to uncontrolled cell division and growth, which causes CML. Radiation exposure. Although rare, exposure to high levels of radiation such as from nuclear accidents has been linked to an increased risk of developing CML. Age and gender. CML is more common in older adults, typically occurring in people over 60, and is slightly more common in men than in women. Phases of CML. CML progresses through 3 distinct phases, each with its own characteristics and severity. Chronic phase. This is the earliest and most common phase, where the disease progresses slowly. Most people are diagnosed during this phase. Symptoms may be mild or absent, and treatment is often very effective at this stage. Accelerated phase. The disease begins to progress more rapidly. An increase in the number of abnormal cells is observed, and symptoms become more pronounced. The response to treatment may be less effective during this phase. Blast phase or blast crisis. This is the most severe phase, resembling acute leukemia. A high number of immature white blood cells blasts are present in the blood and bone marrow. Symptoms are severe, and the disease becomes more challenging to treat. Symptoms of CML can vary depending on the phase of the disease, but common symptoms include fatigue, persistent tiredness or weakness, weight loss, unexplained weight loss without trying, night sweats, excessive sweating, particularly at night, fever, unexplained fevers that may come and go, abdominal discomfort, often due to an enlarged spleen, which can cause pain or a feeling of fullness in the upper left abdomen, bone pain, pain or tenderness in the bones, especially in the arms or legs, frequent infections due to impaired immune function, bleeding or bruising easily as a result of low platelet counts, pale skin due to anemia caused by the reduced number of red blood cells. Diagnosis. CML is often diagnosed through routine blood tests, but specific tests are needed to confirm the diagnosis and understand the disease's characteristics. Complete blood count. CBC reveals an increased number of white blood cells and may show anemia or low platelet counts. Bone marrow biopsy. The sample of bone marrow is examined to assess the number of leukemia cells and the extent of disease involvement. Cytogenetic testing detects the Philadelphia chromosome and other genetic abnormalities in the leukemia cells. polymerase chain reaction PCR, a highly sensitive test that can detect the BCR-ABL gene, confirming the presence of CML. Fish fluorescence in situ hybridization, another test to detect the Philadelphia chromosome in blood or bone marrow cells. Treatment for CML is generally very effective, particularly when started in the chronic phase. The mainstay of treatment includes tyrosine kinase inhibitors (TKIs). These drugs target the BCR-ABL protein produced by the Philadelphia chromosome, blocking its activity and slowing or stopping the growth of leukemia cells. Common TKIs include imatinib, gleevec, dasatinib, spersolnilotinib, tasignibosudinib, bosutinib, and donatinib biselucide. TKIs have transformed CML from a fatal disease into a manageable chronic condition for many patients. Chemotherapy, while less commonly used now, traditional chemotherapy may be necessary in the blast phase or for patients who do not respond to TKIs. Stem cell transplant, also known as a bone marrow transplant. This procedure may be considered for younger patients or those in the accelerated or blast phase who do not respond to TKIs. It involves replacing diseased bone marrow with healthy marrow from a compatible donor. Interferon therapy, used less frequently due to the effectiveness of TKIs, but sometimes employed when TKIs are not suitable. Supportive care, treatment to manage symptoms and side effects, such as blood transfusions for anemia or medications to boost low blood cell counts. Prognosis. The prognosis for CML has improved dramatically with the advent of TKIs. Many people diagnosed in the chronic phase can expect to live long, healthy lives with proper treatment. The disease can often be managed as a chronic condition, with many patients achieving long-term remission. However, prognosis can be poorer for those diagnosed in the accelerated or blast phases, making early detection and treatment critical. Living with CML, regular monitoring, frequent blood tests and follow-up appointments are essential to monitor the disease and adjust treatment as needed. Medication adherence. Taking TKIs as prescribed is crucial for controlling CML. Missing doses can lead to drug resistance and disease progression. Healthy lifestyle. Maintaining a balanced diet, regular exercise, and avoiding infections are important aspects of living with CML. Emotional support. Living with a chronic illness can be challenging, and support from family, friends, or counseling services can be beneficial. When to seek medical attention if you experience symptoms suggestive of CML, such as unexplained fatigue, weight loss, or abdominal discomfort. If you are diagnosed with CML and notice any new or worsening symptoms, particularly if you are undergoing treatment. If you have side effects from treatment that are difficult to manage or that interfere with your quality of life. Chronic myeloid leukemia is a condition that can be managed effectively with modern treatments, particularly when diagnosed early. With appropriate therapy, many patients with CML can lead normal, active lives.